In this video, I'm going to discuss the function of different vitamins as cofactors in the enzymatic reactions, and then discuss the clinical symptoms that can arise from their deficiency. So first, I will start with the water-soluble vitamins, and then later on discuss the lipid-soluble vitamins like vitamin D, vitamin E, vitamin A, and vitamin K. So the first is vitamin B1 or thiamine, which is important cofactor for the alpha-ketoglutarate dehydrogenase, which is used in the TCA cycle, transketolase, which is used in the HMP shunt, as well as the pyruvate dehydrogenase, which is important for shifting of the glycolysis into the TCA cycle. So one way that I memorize the enzymes that are dependent on the thiamine or vitamin B1 is that, TCA cycle is important for ATP production. So vitamin B1 is very important for ATP production, and the enzymes that are being affected include ATP. So alpha-ketoglutarate, transketolase, as well as pyruvate dehydrogenase. Now regarding the transketolase, I would like to quickly summarize its function in the HMP shunt, which is important for the conversion of the glucose 6-phosphate into 2-NADPH and the ribulose 5-phosphate. And then ribulose 5-phosphate via the non-oxidative reaction by transketolase will be later on converted into the nucleotides, which is important for DNA synthesis. And then another important function of the NADPH is to produce the glutathione. So glutathione is important for maintaining the antioxidant state in the body. So here is the enzyme through which the NADPH will be converted into the NAD+, but then it will convert the oxidized form of glutathione into the reduced form. And now the reduced form can detoxify the hydrogen peroxide by the glutathione peroxidase enzyme. And again, GSSG will be produced, but the H2O2 will be broken down into the oxygen and water. So in any case, back to the table. So the function of the thiamine is to help with the function of the HMP shunt as well as ATP production in the TCA cycle. Now there could be vitamin B1 deficiency from alcoholism, which leads to the Wernicke and Korsakoff syndromes, or it could be from malnutrition, for instance, which leads to the beriberi syndrome. So first, starting with the alcoholism, which inhibits the absorption of thiamine, as a consequence of which it can cause damage to the mammillary bodies. And so symptoms of Wernicke, which is often reversible, include encephalopathy, oculomotor dysfunction, as well as gait ataxia. And then if the symptoms are not reversed and thiamine with glucose are not infused in these patients, then it can progress into the Korsakoff, which is irreversible. And this condition presents with the confabulations, psychosis, as well as anterograde/retrograde amnesia. And so therefore, it's important for the alcoholic patients to provide them with the mix of the glucose and thiamine. If you only provide glucose, it will worsen the condition because there is problem with the breakdown of the glucose. So what you will have to do is that you will have to provide with the vitamin deficiency, which is thiamine, along with the glucose to help replenish the ATP pool and reverse the effects of the Wernicke in patients with the alcoholic toxicity. And then other symptoms of the vitamin B1 deficiency which can arise from malnutrition include wet beriberi, where there is dilated cardiomyopathy with risk of high cardiac output failure, and it could also cause dry beriberi, which presents with the polyneuritis as well as muscle wasting. The next vitamin deficiency is vitamin B2 or riboflavin deficiency, which is an important cofactor for the dehydrogenase reactions, like for instance pyruvate dehydrogenase as well as alpha-ketoglutarate dehydrogenase. Now deficiency of vitamin B2 can cause corneal neovascularization as well as cheilitis. And so cheilitis presents with the cracking of the corners of the mouth. And then memory aid that I have for you is that vitamin B2 deficiency affects two corneas and also affects the two corners of the mouth. So let me show you an example of cheilitis. So here's an example of cheilitis where you see that the corner of the mouth has cracking. The next vitamin deficiency is vitamin B3 or niacin deficiency, and niacin is again important for dehydrogenase enzyme reactions. And then vitamin B3 or niacin is being produced from the tryptophan, and for their conversion of tryptophan to niacin, vitamin B6 is required. So therefore, any conditions that will cause disturbance of the tryptophan pool will cause niacin deficiency. So for instance, in the heart knob disease, where there is decreased absorption of the tryptophan, patients will have niacin deficiency. On the other hand, with the carcinoid syndrome, there is increased metabolism of the tryptophan. So tryptophan is also being converted into the serotonin. So with the carcinoid syndrome, there is too much production of the serotonin, as a consequence of which the tryptophan pool will be all used towards the production of the serotonin. And thus now there would be deficiency of the niacin. So either from decreased absorption in heart knob disease or increased metabolism in carcinoid syndrome, there could be deficiency of vitamin B3. And so deficiency will present with the pellagra, where patients will have diarrhea, dermatitis, dementia, and possibly death. So the memory aid for that is that 4 Ds: diarrhea, dermatitis, dementia, and death are all associated with the niacin or vitamin B3 deficiency. And then you may also recall that vitamin B3, it is used for the treatment of the hyperlipidemia, so it can be used to lower LDL and also to increase HDL. And then because of the increased production of the prostaglandin, niacin administration can cause facial flushing. So therefore, because it's the prostaglandin that is causing facial flushing, you can prevent this adverse effect from the excess niacin by administering aspirin in these patients. So again, excess vitamin B3 or niacin can cause facial flushing due to the elevation of prostaglandin, and you can reverse this process by administering aspirin to these patients. The next vitamin is vitamin B5 or pantothenate, which is required for the fatty acyl coenzyme A synthetase activity, for pyruvate dehydrogenase, as well as alpha-ketoglutarate dehydrogenase activity. Now you may ask, what's going on? Like you say vitamin B1, vitamin B2, vitamin B3, vitamin B1, everything is required for the function of pyruvate dehydrogenase and alpha-ketoglutarate, and the answer is yes. So pyruvate and alpha-ketoglutarate dehydrogenases are dependent on many different vitamins as their cofactors, which include vitamin B1, B2, B3, B5, as well as lipoic acid. Now, both of these enzymes are required for the ATP production. So therefore, exercise will activate the pyruvate dehydrogenase as well as alpha-ketoglutarate to increase the ATP production. And factors that will induce elevation activity of these enzymes via exercise is increased NAD+ to NADH ratio, increased ADP, as well as increased calcium. So all of these factors will activate these enzymes, as a consequence of which now there would be increased ATP production. And then you should also note that the arsenic toxicity can inhibit the lipoic acid component of these enzymes, as a consequence of which it will interrupt the ATP production. So patients with the arsenic toxicity present with garlic breath, nausea, vomiting, and rice water stools. Now, there is another infection that is associated with the production of rice water stool. And could you tell me what that is? So infection with the cholera can also lead to the development of rice water stools. But the difference with the arsenic toxicity is that cholera toxin is non-bloody rice water stool. So cholera toxin is causing non-bloody diarrhea, versus arsenic toxicity is causing bloody rice water stool. And the reason for that is that arsenic increases the permeability of the blood vessels, as a consequence of which now there would be blood in the diarrhea. The next vitamin is vitamin B6 or pyridoxine, which is required for the aspartate transaminase as well as alanine transaminase enzymes activities, which are required for the protein catabolism. In addition, they are required for delta aminolevulinase synthase activity, which is required for heme synthesis. And then finally, vitamin B6 is required for the dopa carboxylase enzyme activity, which is required in the catecholamine synthesis pathway. So therefore, deficiency of vitamin B6, which is commonly seen for instance with drugs like isoniazid, can cause convulsions. It can also lead to sideroblastic anemia because it's now interfering with the heme synthesis pathway, and it could also lead to the peripheral neuropathy. The next vitamin is vitamin B7, which is important in the carboxylase activity. So carboxylase will add a carbon to the substrate. So with the pyruvate carboxylase, pyruvate, which is 3 carbon, will be converted into the oxaloacetate, which has 4 carbon. Acetyl coenzyme A will be converted into the malonyl coenzyme A that has 3 carbon. So 1 more carbon more than acetyl coenzyme A. And finally, propionyl coenzyme A carboxylase will convert propionyl coenzyme A from 3 carbon into the methylmalonic coenzyme A, which has 4 carbon. So biotin is required in carboxylase reaction, which adds a carbon to the substrate. And then conditions that can cause biotin deficiency include, for instance, the consumption of raw eggs. As a consequence of which, since it has avidin, it will cause deficiency of the biotin, because avidin is a biotin binding protein. And so deficiency of biotin can cause bowel inflammation, muscle pain, as well as hair loss or alopecia, the other term that is used for it. The next vitamin is vitamin B9, which has an important role in the synthesis of the nucleotide for DNA synthesis. So folate is required for thymidylate synthase activity as well as purine synthesis enzymes. Now, deficiency of vitamin B9, which can result from alcoholism, pregnancy, or drugs like, for instance, methotrexate, sulfonamides, or phenytoin, can cause homocysteinemia, and I will show you the pathway why vitamin B9 deficiency causes homocysteinemia. But then, as a consequence of homocysteinemia, now there is increased risk of the deep venous thrombosis as well as atherosclerosis and dislocation of the lenses. In addition, vitamin B9 deficiency, since it interferes with the DNA synthesis, it will cause megaloblastic macrocytic anemia. But unlike vitamin B12, which also causes megaloblastic macrocytic anemia, there is no neurologic defects with vitamin B9 deficiency. So vitamin B12 does cause neurological defects, but vitamin B9 does not cause neurological defects. And then finally, neural tube defect is another complication of the folate deficiency, and thus it's very important to supplement pregnant patients with the folate to prevent neural tube defects in the child. So let me explain to you why folate is causing homocysteinemia. So here is the pathway where homocysteine can be either converted into the cysteine or converted into the methionine. So deficiency of any one of these enzymes will cause elevated level of homocysteine and thus cause homocysteinemia. So for instance, deficiency of the cysteine synthase or decreased affinity of this enzyme for vitamin B6 will cause homocysteinemia. In addition, deficiency of the homocysteine methyltransferase, deficiency of vitamin B12, or deficiency of folate, again, all of these conditions can cause homocysteinemia. So if I refer you to the table that I have right here, which of these vitamins, vitamin B12 or folic acid, are associated with homocysteinemia, and the answer is both of them will cause elevated level of homocysteine. But then with vitamin B12, it's also required for the conversion of the methylmalonic coenzyme A into succinylcoenzyme A. So if vitamin B12 is disrupted, now there would be elevation of the methylmalonic coenzyme A. So vitamin B12 deficiency also causes elevation of methylmalonic acid, and thus measurement of the methylmalonic acid is a very accurate test to check for vitamin B12 deficiency. And then note that vitamin B9 has no role in this pathway, so therefore deficiency of the folic acid or vitamin B9 doesn't affect the levels of methylmalonic acid. So once again, both vitamin B12 and folic acid deficiency will cause elevated level of homocysteine, while it's only vitamin B12 deficiency that cause elevated level of the methylmalonic acid. In addition, both of these vitamin deficiency cause megaloblastic macrocytic anemia as well as hypersegmented neutrophils, but again, it's only vitamin B12 that will cause neurologic defects. And then one last point I would like to mention is that you may recall that I mentioned that vitamin B6 is required as a cofactor for dopa decarboxylase in the catecholamine synthesis pathway. So here is where vitamin B6 plays a role. And then, as I will discuss later, vitamin C is also required as a cofactor for the dopamine hydroxylase in the catecholamine synthesis pathway. So here is the catecholamine synthesis pathway where phenylalanine will be converted to tyrosine, L-DOPA will be converted into dopamine, norepinephrine, and finally epinephrine. So therefore, vitamin B6 and vitamin C are important components of the catecholamine synthesis pathway. Now, the next vitamin deficiency are vitamin B12 and vitamin C. So with the vitamin B12, as we discussed earlier, it will cause deficiency of the homocysteine methyltransferase activity, as well as it will interfere with the activity of the methylmalonic coenzyme A mutase. So therefore there would be elevation of both the homocysteine as well as methylmalonyl, and thus measurement of the levels of methylmalonyl is an accurate test for the diagnosis of vitamin B12 deficiency. And then the common causes of vitamin B12 deficiency include, for instance, pernicious anemia, where there are autoantibodies that are formed against parietal cells. And parietal cells are required for the secretion of the intrinsic factor, and intrinsic factor will bind to vitamin B12, and this intrinsic factor vitamin B12 complex can now get absorbed in the ileum. So if we have destruction of the parietal cells by the autoantibodies, thus there won't be any more intrinsic factor, and thus vitamin B12 can no longer get absorbed. And so this condition is referred to as pernicious anemia. Other causes of B12 deficiency include gastric bypass, aging, poor nutrition. In addition, in vegans, there is also vitamin B12 deficiency. And then finally, ileal disease. So intrinsic factor B12 needs to be absorbed in the ileum. So if there is an ileal disease, like for instance from bacterial overgrowth or resection of the ileum in patients with Crohn's disease, then there would be vitamin B12 deficiency. Now, symptoms of vitamin B12 deficiency, similar to the folate, it can cause hypersegmented neutrophils as well as megaloblastic macrocytic anemia. But another feature that is also present with the B12 deficiency is the peripheral neuropathy, as well as the demyelination of dorsal column, as well as the spinocerebellar tract. So this feature, the third feature, is not being caused by the folate, but it is being present with the vitamin B12 deficiency. Now, one other point I would like to mention is that vitamin E deficiency also has the same pattern of the spinal cord degeneration. So vitamin E deficiency, similar to vitamin B12, causes posterior column as well as the spinocerebellar tract demyelination, as a consequence of which patients will have ataxia with decreased sense of vibration as well as position sense, which is the function of the dorsal column for the fine touch, vibration, as well as position sense. So now that there is degeneration of the dorsal column, patients will have difficulty with these functions. Now back to the top. The last water-soluble vitamin that we have here is ascorbate, or vitamin C, which has an important role in the collagen synthesis pathway, which I will discuss next. It's also required for the dopamine beta hydroxylase enzyme in the catecholamine synthesis pathway, and I just shown that to you earlier. So vitamin C has an important role in the catecholamine synthesis pathway by acting as a cofactor for the dopamine hydroxylase enzyme. And then it also has an important role in the absorption of the iron. So patients that have iron deficiency, it's more efficient if you supply vitamin C in addition to the iron, and because vitamin C increases the absorption of the iron. Now, complications of the vitamin C deficiency include scurvy, and that is due to the interruption of the collagen synthesis pathway, as a consequence of which patients can present with petechia. They could have ecchymosis, bleeding gums, cold hairs, hyperkeratosis, as well as impaired wound healing. So let me show you the collagen synthesis pathway next, so that you know why vitamin C is important. So here we have the DNA, which will produce the mRNA, and mRNA will enter the rough endoplasmic reticulum, and inside there it will get translated into the pre-procollagen, which is made of a sequences of the glycine as well as two consequent amino acids, which are usually proline and lysine. And so glycine keep on repeating every third amino acid. So we have glycine, two more amino acids, glycine, two more amino acids, glycine, two more amino acids, and so on. So that's an important characteristic feature of the pre-procollagen. And then in the next step, proline and lysine residues will undergo hydroxylation, for which vitamin C is playing an important role. So if there is a deficiency of vitamin C, then patients will develop scurvy and present with petechia, for instance, and bleeding of the gums. So hydroxylation step of the collagen synthesis pathway is dependent on vitamin C. Later on, there would be glycosylation of the polypeptide chain, and then finally triple helix will be formed. So all of these steps, step 1, 2, and 3, are taking place in the endoplasmic reticulum. Now, patients that have osteogenesis imperfecta, they have problem with the formation of triple helix in collagen 1. Later on, the triple helix will be exported out into the Golgi apparatus and get outside into the extracellular space, Over there, the procollagen will be cleaved, so the sides would be trimmed off, and tropocollagen will remain. And then later on, tropocollagen will make cross-links via the covalent bonds between the lysine and hydroxylysine and form the collagen fibrils. So in patients that have Ehlers-Danlos, there is problem with the lysyl oxidase enzyme, and thus there won't be any covalent linkage between lysine and hydroxylysine. So again, to summarize the important findings in this slide is that vitamin C interferes with the hydroxylation step of the collagen synthesis. Osteogenesis imperfecta causes interference with the formation of triple helix of collagen 1, and then finally Ehlers-Danlos interferes with the formation of the covalent bonds by interfering with the lysyl oxidase, and Ehlers-Danlos is usually affecting collagen 3. And then here I have memory aids that will make it easy for you to memorize some of the functions of the vitamins that I've listed there. So alcoholism causes vitamin B9 as well as vitamin B1 or thiamine deficiency. So alcohol 911, every time someone has alcohol toxicity, you call 911. So alcohol abuse can cause vitamin B9 and vitamin B1 deficiency. And then vegan diet also causes vitamin B12 deficiency. So here I have dozen of vegetables. So dozen go for vitamin B12. And then if you have difficulty memorizing the name of every one of these vitamins, here I have another memory aid for you. So torn, poppy, foco. So T goes for thiamine, R goes for riboflavin, niacin, pantothenic acid, pyridoxine, folic acid, as well as cobalamin. So here, torn, poppy, foco. So without looking at the table there, we have the thiamine, riboflavin, niacin, pantothenic acid, pyridoxine, folate, as well as cobalamin. And so that would be vitamin B1, B2, B3, B5, B6, B9, and then finally B12. And then vitamin B7 is not listed here, but vitamin B7 would be biotin. And then for fat-soluble vitamins, DEAK is the memory aid. So vitamin D, vitamin E, vitamin A, and vitamin K are fat-soluble vitamins. And so now the final topic that I would like to discuss with you is the fat-soluble vitamins, which include DEAK, vitamin D, E, A, and K. So first, starting with the vitamin D or cholecalciferol, it's important for the calcium absorption. And thus, patients that have vitamin D deficiency would have calcium deficiency, as a consequence of which it will cause rickets in children, and it will cause bowing of arms and legs, as well as rachitic rosary. So let me show you an example. So here you can see that there is bowing of legs as well as bowing of arms in patients that have rickets, and this is due to the decreased mineralization of the osteoid matrix. So there is a normal osteoids there, but because of the decreased mineralization, now there would be bowing of the arms as well as legs. And then because of the abnormal deposition of the osteoids, patients will have deformity of the chest wall, which is shown right here, and this condition is referred to as rachitic rosary. So back to the table here, rickets in childhood can cause bowing of the extremities as well as rachitic rosaries. And then in adults, there's fusion of the epiphyseal plate. And so it can cause bone pain, fracture, and then in very severe cases, it can eventually lead to the tibial bowing. The next vitamin is vitamin E, which, as I just discussed earlier, it can cause the posterior column as well as the spinocerebellar tract demyelination from its deficiency, which causes ataxia as well as loss of position and vibration sense. In addition, vitamin E is a very strong antioxidant, and thus it will protect red blood cells and lipid membranes against oxidation. So if there is vitamin E deficiency, then it would lead to the hemolysis. The next vitamin is vitamin A or retinol, which is important for differentiation of the epithelial cells. It will prevent the squamous cell metaplasia, and is also playing an important role in the retina and the vision. So vitamin A is usually found in leafy vegetables as well as the liver. And just to give you an example that liver is rich in vitamin A, is that liver of the polar bear is so rich in vitamin A that it can become toxic and kill whomever that eats that. So therefore, that helps you remember that liver is rich in vitamin A. And so remember that you shouldn't eat the liver of the polar bear because it has so much vitamin A that can cause toxicity of this vitamin. Deficiency of vitamin A can cause night blindness. So as I just discussed, it has an important role in rod and cone cells. It can also cause skin dryness as well as the follicular hyperkeratosis and metaplasia of corneal epithelium. Now, clinical use include, for instance, for the treatment of the acute myelogenous leukemia, the M3 subtype. It's also used for the treatment of measles as well as acne. So for the acne, you can either use it topical or you can use the isotretinoin, which is oral medication. But then isotretinoin is a teratogen. So if you're planning on giving isotretinoin in a female, the first thing that you have to do is that you have to make sure that she is not pregnant. And then once you rule out pregnancy, then you can prescribe these medications. In addition, vitamin A topical can be used for the treatment of wrinkles. And then the final vitamin that we have is vitamin K, which is important for the carboxylation of glutamic acid residues in the coagulation factors 2, 7, 9, and 10. And then it's also used for the activation of the anticoagulation factors protein C and S. So vitamin K has kind of like a controversial function, is in that it activates both the coagulation factors as well as anticoagulation factors. Now, conditions that can cause vitamin K deficiency include any condition that, for instance, interferes with the intestinal flora, because vitamin K itself is being produced by the intestinal flora. So, for instance, in neonates who have sterile GI tract, they could have deficiency of vitamin K, and thus that's the reason that the newborns, the first thing that they're receiving is a shot of vitamin K. In addition, long-term antibiotic use can cause disruption of the intestinal flora, as a consequence of which it will cause vitamin K deficiency. And then finally, conditions that cause malabsorption of fats, like for instance from pancreatic failure, therefore there would be low absorption of fats, including the fat-soluble vitamins and vitamin K, will cause vitamin K deficiency. Now, the last point I would like to mention is that warfarin is a vitamin K antagonist that is used for its anticoagulation properties. So warfarin, by blocking the carboxylation of factors 2, 7, 9, and 10, it will be used as an anticoagulant. So it will decrease the coagulation. But then the problem is that there is also protein C and S, which have a shorter half-life than the other ones. So first, when you administer warfarin, you will destroy the anticoagulation factors. So initially, there would be a hypercoagulation state. And so therefore, these patients are at increased risk of skin necrosis as well as gangrene. And thus the solution for this problem is that every time you want to start someone on warfarin, you have to start them first with the heparin. So there has to be co-administration of warfarin with heparin to cause anticoagulation. And once warfarin a few days has passed, when the other factors 2, 7, 9, and 10 has been deactivated, then you can discontinue heparin. But just keep that in mind, that warfarin initially, due to the inactivation of protein C and S, will cause hypercoagulation state that leads to skin necrosis and gangrene. And in order to prevent this problem, you will do heparin bridging. And that concludes our discussion of the function of different vitamins.